If you're taking a beta blocker or a calcium channel blocker, the first thing to understand is that these medications were not created to make your life more difficult. They were designed to help your heart work more efficiently and to lower the risks that come with conditions like high blood pressure, irregular heart rhythms, and heart disease. Yet many seniors take these medications every day without fully understanding what they're actually doing inside the body. And when you understand how they work, many of the changes you notice later begin to make much more sense. Let's start with beta blockers. Think of your heart as an engine. Throughout the day, your body releases stress hormones such as adrenaline that tell that engine to work harder and faster. Beta blockers help reduce the effects of those hormones. As a result, your heart beats more slowly and with less force. This means your heart doesn't have to work as hard to pump blood throughout the body. For someone with high blood pressure, a history of heart problems, or certain rhythm disorders, that can be incredibly beneficial. Many seniors are prescribed beta blockers after a heart attack because they help protect the heart from excessive strain. Others take them to manage conditions such as atrial fibrillation, angina, or chronic heart failure. In many cases, these medications have helped people live longer and avoid serious cardiovascular complications. That's why doctors continue to rely on them as an important part of treatment. Calcium channel blockers work differently. Instead of focusing primarily on the heart's response to stress hormones, they target the muscles in the walls of blood vessels. Calcium is one of the substances that helps those muscles contract. By limiting the movement of calcium into these muscle cells, the medication allows blood vessels to relax and widen. When blood vessels become more relaxed, blood can flow more easily, and blood pressure often comes down. Some calcium channel blockers also affect the heart itself by helping regulate heart rhythm and reducing the workload placed on the heart muscle. Depending on your specific health condition, your doctor may choose a calcium channel blocker instead of a beta blocker, or sometimes even prescribe both together under careful supervision. Now, here's something many seniors don't realize. Just because two people have high blood pressure doesn't mean they need the same medication. Doctors consider many factors before making a recommendation. Your age, heart rate, medical history, kidney function, other medications, and even certain symptoms all play a role. What works beautifully for one person may not be the best choice for another. This is why it's so important not to compare your prescription with a friend, neighbor, or family member. The medication you're taking was selected based on your unique health picture. Understanding that can help build confidence in your treatment plan and encourage more productive conversations with your healthcare provider. Another important point is that these medications are managing a condition, not necessarily curing it. Many people begin taking them, feel better after a few months, and assume they no longer need them. But often the reason they're feeling better is because the medication is doing its job. Consistency matters. Taking the medication as directed allows it to provide the protection your heart and blood vessels need over time. As we continue, you'll see that understanding how these medications work is only the beginning. Once you know their purpose, it becomes much easier to recognize the changes they may cause, the benefits they provide, and the precautions that can help you stay healthy and active for years to come. Knowledge is the first step toward taking control of your heart health. Now that we've talked about why beta blockers and calcium channel blockers are prescribed and how they work, let's discuss something that many seniors notice but don't always connect to their medication: the subtle changes that can appear in everyday life. One of the most common comments I hear from patients is, "I just don't have the same energy I used to." Now, there are many reasons why energy levels can change as we get older, but sometimes the medication itself may play a role. Remember, beta blockers are designed to slow the heart rate and reduce the effects of adrenaline. That's exactly what helps protect the heart. However, because your body isn't responding to stress hormones in the same way, some people may feel less energetic, especially when they first start taking the medication. For example, activities that once felt easy may suddenly require a little more effort. Walking upstairs, carrying groceries, or working in the garden might leave you feeling more tired than expected. This doesn't necessarily mean something is wrong. In many cases, it's simply the body adjusting to a different heart rate and a different level of cardiovascular activity. Calcium channel blockers can create their own set of day-to-day changes. Since these medications relax blood vessels, blood pressure may drop more efficiently. That's good for your heart and circulation, but sometimes it can also contribute to feelings of lightheadedness, especially when standing up quickly. Have you ever stood up from a chair and suddenly felt a brief wave of dizziness? That's something some people experience when their blood pressure temporarily struggles to adjust. This is particularly important for seniors because balance becomes increasingly valuable as we age. A minor episode of dizziness might not seem like a big deal, but it can increase the risk of falls. That's why I often encourage people to rise slowly from bed or from a seated position. Giving your body a few extra seconds can make a remarkable difference. Another change that often surprises people is a reduced ability to tolerate exercise. Now, that doesn't mean exercise becomes dangerous. In fact, physical activity remains one of the best things you can do for heart health. But because beta blockers prevent the heart from speeding up as much during exertion, you may not be able to exercise at the same intensity you once could. Many people become concerned when they notice their heart rate doesn't climb the way it used to during a brisk walk. They assume something is wrong. In reality, the medication may simply be doing exactly what it was designed to do. This is why paying attention to how you feel during activity can sometimes be more helpful than focusing solely on the numbers. Some seniors also notice changes in sleep patterns or overall stamina throughout the day. Others report feeling cooler than usual, especially in their hands and feet. While these effects aren't experienced by everyone, they can occur because of the way these medications influence circulation and cardiovascular function. What's important to understand is that there is a difference between expected adjustments and warning signs. Mild fatigue during the first few weeks of treatment may be normal. Brief lightheadedness when standing up too quickly may be manageable, but severe dizziness, fainting, significant shortness of breath, chest pain, or dramatic changes in how you feel should never be ignored. One of the biggest mistakes people make is assuming they simply have to live with it. If a medication is affecting your quality of life, speak with your healthcare provider. Sometimes a dosage adjustment, a different medication, or a change in timing can make a tremendous difference. There are often options available. The key is to become a careful observer of your own body. Pay attention to changes. Keep track of symptoms. Notice how you feel during daily activities. The more information you can provide your healthcare team, the better they can help tailor treatment to your specific needs. As we move forward, you'll discover that some of the symptoms people often blame on getting older may not be aging at all. In fact, many of them may be closely connected to the medications they're taking every day. When you understand the changes, you gain the power to manage them wisely. As we continue, I want to focus on something that affects countless seniors every single day, yet often goes unnoticed. It's the tendency to assume that every new symptom is simply a normal part of getting older. After all, when you're in your 60s, 70s, or 80s, it's easy to blame fatigue, slower movement, or changes in how you feel on age alone. But here's what many people don't realize. Sometimes what appears to be aging may actually be related to the medications you're taking. Now, let me be very clear. Aging does bring natural changes to the body. Energy levels may shift. Recovery may take a little longer. Physical abilities can change over time. That's completely normal. However, problems arise when we automatically assume that every symptom belongs in that category. For example, let's talk about fatigue. A senior might say, "Well, I'm 75 years old. Of course I'm tired." And while age can certainly influence energy levels, beta blockers are also known to slow the heart rate and reduce the body's response to adrenaline. For some people, that can create feelings of sluggishness or reduced stamina. If you suddenly find yourself struggling with activities that were manageable a few months ago, it's worth paying attention. The same thing can happen with dizziness. Many seniors assume occasional dizziness is simply part of getting older, but medications that lower blood pressure can sometimes contribute to lightheadedness, especially when standing up quickly. If that dizziness is becoming frequent, worsening, or affecting your balance, it deserves a conversation with your healthcare provider. Another common example involves a slow heart rate. Beta blockers are specifically designed to reduce how hard and how fast the heart works. That's often beneficial, but some individuals may notice they feel unusually tired, weak, or less able to tolerate physical activity because their heart rate remains lower throughout the day. Again, this doesn't necessarily mean the medication is harmful. It simply means the treatment may need to be evaluated to ensure it's still the best fit. Then there are the hands and feet. I've spoken with many seniors who complain that their hands are always cold or that their feet seem colder than they used to be. Often they assume it's poor circulation caused by age. Sometimes that's true, but beta blockers can also contribute to these sensations by affecting blood flow to the extremities. Calcium channel blockers can create their own misunderstandings. One of the more common side effects is swelling around the ankles or lower legs. Now imagine you're a senior who begins noticing puffiness around the ankles. It's very easy to think, well, my body is just getting older. In reality, the medication may be playing a role. That's important information because your healthcare provider may be able to help manage the issue. What concerns me most is that many people never mention these changes during appointments. They assume the symptoms are inevitable and simply learn to live with them. Unfortunately, that can sometimes lead to unnecessary discomfort or reduced quality of life. I often encourage people to think of themselves as detectives when it comes to their health. Pay attention to timing. Did a symptom begin shortly after a medication was started? Did it become more noticeable after a dosage increase? Has it gradually worsened over time? These details can be incredibly valuable. The goal is not to become fearful of medications. Remember, beta blockers and calcium channel blockers help millions of people manage serious cardiovascular conditions safely and effectively. The goal is awareness. When you understand the possible effects of your treatment, you're better equipped to recognize changes that deserve attention. And here's something I want every senior to remember. Growing older should never mean accepting every symptom without question. Your body is constantly giving you information. Listening carefully to those signals can help you distinguish between normal aging and something that may need medical review. Because sometimes the symptom you've been blaming on age is actually a message worth hearing. Never assume, always stay curious about your health. Now that we've discussed how some medication-related symptoms can be mistaken for normal aging, there's another important issue that every senior should understand. It has nothing to do with the medication itself and everything to do with what happens when that medication meets something else in your daily routine. I'm talking about interactions, those often overlooked situations where medications, supplements, or even certain foods can change the way beta blockers and calcium channel blockers work inside your body. Many seniors are taking more than one prescription medication. In fact, it's not uncommon for someone to be managing blood pressure, cholesterol, diabetes, arthritis, or other health conditions all at the same time. Each medication may be helping in its own way, but when multiple treatments are combined, the possibility of interactions increases. One of the most common situations occurs when two medications affect blood pressure or heart rate at the same time. Remember, beta blockers are designed to slow the heart and reduce its workload. Certain other medications can have similar effects. When combined, the result may sometimes be a heart rate that becomes lower than expected or blood pressure that drops more than intended. For some people, this can lead to fatigue, dizziness, weakness, or an increased risk of falls. This doesn't mean the combination is necessarily dangerous or inappropriate. Many people safely take multiple cardiovascular medications under medical supervision. The important point is that these combinations require monitoring and regular follow-up. Supplements can also create unexpected challenges. Many people assume that because a product is sold over the counter or labeled as natural, it must be completely harmless. Unfortunately, that's not always true. Certain herbal supplements and wellness products can influence blood pressure, circulation, or heart rhythm. Some may amplify the effects of prescription medications, while others may interfere with how those medications work. This is why I always encourage people to tell their healthcare provider about every product they take, not just prescription drugs. That includes vitamins, minerals, herbal remedies, sleep aids, energy boosters, and any supplement purchased online or from a health store. Your doctor can't help identify a potential interaction if they don't know the product exists. Now let's talk about something that surprises many people: food interactions. Most foods can be enjoyed safely while taking these medications, but there is one famous exception that deserves attention. Grapefruit and grapefruit juice can interfere with the way certain calcium channel blockers are processed by the body. When that happens, medication levels may become higher than expected, increasing the risk of side effects. What makes this particularly tricky is that some people consume grapefruit because they've heard it's healthy. And in many situations it is. But healthy foods can still interact with medications. That's why personalized medical advice is always so important. Another issue involves over-the-counter cold and flu products. Many seniors don't realize that some common remedies contain ingredients that can affect blood pressure or place additional stress on the cardiovascular system. Before taking any new non-prescription medication, it's wise to check with a pharmacist or healthcare provider. I also encourage people to keep an updated medication list with them at all times. It sounds simple, but it can be incredibly valuable. Include prescription medications, supplements, vitamins, and dosages whenever possible. If you visit a new doctor, a specialist, an urgent care clinic, or even a pharmacy, having that information readily available can help prevent mistakes and identify potential concerns. Think of this list as a safety tool. In an emergency situation, it may provide healthcare professionals with critical information they need to make safe decisions quickly. The reality is that most serious medication interactions are preventable when communication is strong. Problems often occur not because people are careless, but because information gets scattered between multiple providers, multiple prescriptions, and multiple products. The more organized and informed you are, the safer your treatment becomes. Your medications don't work in isolation. They work within the larger picture of everything you put into your body. Protecting your heart isn't just about taking the right medication. It's about making sure everything around it works together safely. By now, we've talked about how beta blockers and calcium channel blockers work, the day-to-day changes they can cause, and the interactions that many seniors may not realize are affecting their treatment. But there is another question that comes up frequently, especially among people who have been taking these medications for years. They often ask, what happens if I stay on these medications long-term? It's a very reasonable question. After all, many seniors don't take beta blockers or calcium channel blockers for a few weeks or even a few months. They may take them for many years, sometimes decades. Naturally, people want to know what that means for their future health. The first thing I want to emphasize is that these medications have helped millions of people live longer, healthier lives. They are not simply treating numbers on a blood pressure monitor. In many cases, they are reducing strain on the heart, lowering the risk of serious cardiovascular events, and helping protect vital organs from damage caused by uncontrolled blood pressure. When blood pressure remains elevated year after year, it quietly affects nearly every part of the body. The heart has to work harder. Blood vessels become damaged. The risk of heart attacks, strokes, kidney disease, and vision problems increases. By helping control blood pressure and support healthy cardiovascular function, these medications can play a major role in preventing those complications. That means when we discuss long-term use, it's important to look at both sides of the picture. People often focus on potential side effects, but they sometimes forget the risks that the medication is helping prevent. In many situations, the benefits of treatment greatly outweigh the drawbacks. At the same time, long-term treatment does require ongoing attention. One thing many seniors don't realize is that the body changes over time. The dose that worked perfectly at age 65 may not necessarily be the ideal dose at age 75 or 85. Weight can change, kidney function can change, activity levels can change, other health conditions may develop. All of these factors can influence how your body responds to medication. This is one reason regular medical follow-up remains so important, even when you've been taking the same medication for years. Some people assume that if they've been stable for a long time, there is no reason to continue monitoring things closely. In reality, routine evaluations help ensure that treatment remains appropriate as the body evolves. Another important point involves heart rate and blood pressure monitoring. Beta blockers in particular can significantly influence heart rate over time. Calcium channel blockers can affect circulation and blood pressure control. Keeping track of these measurements helps your healthcare provider identify trends before they become problems. I often encourage seniors to think of blood pressure monitoring as a valuable source of information rather than a test they need to pass. A single reading rarely tells the whole story. Patterns over weeks and months are what matter most. Long-term treatment can also reveal subtle changes that weren't present in the beginning. Perhaps fatigue gradually becomes more noticeable. Maybe exercise tolerance changes. Perhaps swelling develops or dizziness becomes more frequent. These developments don't necessarily mean the medication should be stopped, but they do deserve attention. One of the biggest mistakes people make is adjusting medication on their own. They feel better and decide to skip doses. Or they experience a symptom and stop taking the medication without consulting a healthcare professional. Unfortunately, this can sometimes create serious consequences. Blood pressure may rise unexpectedly, heart rhythm problems may return, or the heart may suddenly face increased stress. Consistency remains one of the most important factors in successful long-term treatment. Medications can only provide protection when they're taken as prescribed. The good news is that most seniors who stay engaged with their healthcare team, attend regular checkups, and monitor their health can continue using these medications safely and effectively for many years. The goal is not simply to add years to life, but to add quality to those years as well. The healthiest future belongs to those who manage their medications with the same commitment they bring to protecting their heart. As we bring everything together, I want to leave you with perhaps the most important message of this entire discussion. Beta blockers and calcium channel blockers can be powerful tools for protecting your heart, lowering blood pressure, and reducing the risk of serious health complications. But medications work best when they are part of a larger strategy, one that includes knowledge, consistency, and healthy daily habits. One of the biggest misconceptions I encounter is the belief that medication alone is enough. Many people assume that once they start taking a prescription, the rest takes care of itself. The truth is that medications are most effective when they work alongside healthy choices. Think of your treatment plan as a team effort. The medication has an important job, but so do you. Let's start with something simple: taking your medication exactly as prescribed. It sounds obvious, but missed doses are surprisingly common. Sometimes people forget. Sometimes they feel well and assume they no longer need the medication. Sometimes they become concerned about a side effect and decide to stop on their own. Unfortunately, this can create significant problems. In particular, beta blockers should never be stopped suddenly without medical supervision. When the body has adapted to a medication and it is abruptly discontinued, the heart can react in ways that may increase stress on the cardiovascular system. That's why any changes should always be discussed with your healthcare provider first. Another important habit is staying hydrated. As we age, the body's sense of thirst often becomes less reliable. Some seniors may not drink enough fluids throughout the day, especially during warmer weather. Dehydration can contribute to dizziness, low blood pressure, fatigue, and an increased risk of falls. For individuals already taking medications that influence blood pressure and circulation, maintaining proper hydration becomes even more important. Physical activity also deserves attention. Now, I'm not talking about extreme workouts or spending hours in the gym. I'm talking about regular movement that fits your abilities and your medical condition. Walking, stretching, light strength exercises, and other approved activities can help support circulation, maintain muscle strength, improve balance, and enhance overall cardiovascular health. Some people become discouraged when they notice that their heart rate doesn't respond during exercise the way it used to. Remember, beta blockers often prevent dramatic increases in heart rate. That's normal. Instead of focusing entirely on the numbers, pay attention to how you feel. Are you moving comfortably? Can you carry on a conversation? Are you building endurance safely over time? Those are often better indicators of progress. Monitoring your health at home can also be extremely valuable. Keeping track of blood pressure readings, heart rate measurements, and any new symptoms provides useful information for both you and your healthcare provider. Small changes are often easier to address when they're identified early. I also encourage every senior to become an active participant during medical appointments. Don't be afraid to ask questions. Ask why a medication was prescribed. Ask what side effects to watch for. Ask whether a symptom could be related to treatment. Ask if there are lifestyle changes that could improve your results. The most successful patients are rarely the ones who simply follow instructions without understanding them. They are the individuals who stay informed, stay engaged, and work collaboratively with their healthcare team. Throughout this discussion, we've explored how these medications work, how they affect daily life, how they can sometimes mimic aging, the importance of avoiding interactions, and the role of long-term monitoring. The common thread connecting all of these topics is awareness. Knowledge transforms uncertainty into confidence. When you understand your medications, you're no longer simply taking a pill. You're making informed decisions that support your health, your independence, and your quality of life. Your heart works for you every moment of every day. Give it the attention, consistency, and care it deserves.